Good evening and welcome to Vaccine Rollout, When, Where, and How. This program is designed to move the conversation about vaccine awareness and access from national to regional. Tonight, it's all about the DMV. That's Washington, D.C., Maryland, and Virginia, for those that don't know what the DMV is about. We're also adding West Virginia to this discussion. We're going to have local physicians, pharmacists, community representatives, and citizens to discuss the vaccine rollout in the area and provide some insights on what people in the community need to know to make a more informed vaccine decision. Tonight's program is all about you and addressing your questions about the vaccine. So please put your questions in the comments and we'll try to get to as many of them answered as possible. Okay, I'm going to go ahead and get started here this evening. Looking forward to my first two guests. Really don't need an introduction. They are well known to Black Doctor. They are friends of Black Doctor, and we look forward to them every time they come on. So first up, we have Dr. Gigi from the Rodham Institute.
Hey, good evening, Mr. Ellis. It's always such a pleasure to see you. How are you doing?
I have enjoyed being seen, and thank you. I'm so happy to have you here. Thank you.
And Eid Mubarak to everybody who celebrates. I do. So it's our Eid. So Eid Mubarak, everybody.
Absolutely. And also we have Dr. Lisa Fitzpatrick, who you might recognize as she was a host of Straight Talk with Dr. Lisa here on blackdoctor.org. She's an infectious disease specialist and a friend of the program. She runs Grapevine Health and is a wonderful person, has really been deep in the work as well, especially in the DC metro area. So I want to make sure that we had her on and her wonderful voice here. So welcome, Dr. Lisa.
Hello, good evening. And to you also, Dr. Gigi. Nice to be here.
Always good to see you too, Dr. Lisa. And I love the artwork behind you. And Mr. Ellis, you forgot to mention that I have a show with you.
Yes.
House Calls with Dr. Gigi.
House Calls with Dr. Gigi. Yes, we do. And we're coming back. We're coming back. We've got some great programs coming up. So I'm looking forward to that as well. So if you are watching us this evening, let us know where you're watching from. Just drop it in the chat room and just let us know. Hey, we'd like to see people, just not for the DMV, but from all over, because we're going to ask some questions that are national. So I guess the first question that is on everybody's mind is, now that the vaccine has been approved for 12 to 15-year-olds, do you think this will have an effect on people getting vaccinated? Dr. Lisa, I see your face.
I don't think so.
Okay.
I think our challenge has been, it's a combination of access depending on where you are. Well, if we're talking about DC, I'm talking broadly.
Right.
And then we can zoom into DC. But I think the challenges are access, consistent access, convenient access, along with having access to a trusted health messenger who can non-judgmentally answer your questions. So what we've noticed in our Ask the Doctor sessions and even our work on the street is people are still very confused about a lot of this. And they don't always know where to get information. And if they turn on the TV or the radio or they're with scrolling on social media, they get a lot of conflicting information. And so I think, sure, it's nice that we have data suggesting or showing that the vaccine works in 12 to 15-year-olds, but I don't think we're going to move people who are older, the people who are still waiting to see or who've already decided they just don't want to get vaccinated.
Dr. Gigi?
I was going to say also that both Dr. Lisa and I are on the Black Coalition Against COVID, where we've kind of done a deeper dive as a coalition to look at who the groups are within the African American community that are, still have questions, et cetera. And that's the younger group, 18 to 45. And so as we think about how to reach out, we really have to target our efforts to that group. But let me tell you where I was this weekend, because I think to Dr. Lisa's points, there are some excellent community-led efforts which are successful. So I had the pleasure of spending 2 hours at the Temple of Praise Baptist Church in Ward 8, which has about 10,000 congregants. Bishop Staples, I think, oversees like 30 churches, and they have vaccinated 4,600 people so far. And to Dr. Lisa's point, they have, I think, 3 times a week vaccinations. They also have testing. They've got like 12 sort of portable clinic rooms right there, so that everything is safe from a COVID prevention perspective. Every time that they have these events, which is 3 times a week, they run out of vaccine. And what they're doing, which I think is such a key point, and we certainly sort of experienced this in a mass vaccination event, the Rodham Institute co-sponsored, along with Ms. Cora Masters-Berry, a former First Lady and founder of the Southeast Tennyson Learning Center, are a couple of things. One, people have been treated so badly. I mean, here, especially in Washington, D.C., we've been used and abused by the previous administration. We've not only had the COVID pandemic, we've had the Trump pandemic, the serial murders of Black people pandemic. So people are, of course, skeptical because you know what? We're being targeted, right? And so that's one aspect. So having, as Dr. Lisa, sort of stated at the outset, people who are trusted leaders. So Temple of Praise, all the, the bishops, the deacons, the pastors got vaccinated on the pulpit. And there have been vaccine education town halls. They've also, I should say, have fed 1.2 million, or have served 1.2 million meals since the pandemic. And finally, 2 more points I want to make. When you don't have hope, what does it matter about a vaccine? There is a type of sort of fatalism that exists, and that's from not having hope. So my mom, who's a medical anthropologist, and in the 90s, we wrote the introduction to the Black Anthropology Journal issue that was about AIDS in the Black community. And one of the researchers noted that young Black men were not going to use condoms because, you know what, they're very smart. They did a risk assessment and found that their chances of dying from gun violence before they hit 25 are high, right, compared to contracting HIV. So that's one. The second issue is competing priorities. And that's, what we also found, and to Dr. Lisa's point, making it easy, because if you've got a gazillion things that you're worried about, putting food on the table, taking care of multi-generational households, showing up to work, et cetera, your health in general is going to be last on the list. You add to that the trust issues. And so it's not surprising, it's actually predictable. And that's why we really need to look at models that are successful, not doing the same thing over and over again, expecting better results. You're muted.
Sorry, it happens all
I know. It's all of us.
So you bring up a good point, Dr. Gigi. And so I'm going to ask you this, Dr. Lisa. Do you think that the challenges of vaccine acceptance by Black and Brown communities are the same now that they were at the beginning of the pandemic, or at the beginning of the vaccine rollout?
Well, I think I think the conversations shift and they sort of wander around. But ultimately, the most common question I got at the beginning and even now is about safety. Is the vaccine safe? How do I know? And so, I think the most of the young people, Dr. Gigi was just talking about how younger people are less likely to want the vaccine. What they're saying to me is, well, I'm healthy. And most of the people who have, that get sick from COVID, they're older people. And I can't refute that. That's a true statement. And even when I appeal to their sense of community and say, well, if you take the vaccine, then you're also protecting your loved ones. A lot of times that doesn't resonate either. Their questions are, I don't know what's in it. You can't guarantee me it's safe. So I think that's a question we'll continue to have. And I think part of it is the way this process, the way the vaccines, the way the pandemic has been politicized from the beginning. And so it's hard to walk that back and help people feel a sense of comfort. It just depends on who you're talking to. So I think we need to remember that to get to herd immunity, we don't need everybody. So it's okay that we will still have, 15 or 20% of the population who decides they will ultimately refuse the vaccine no matter what. As long as we answer people's questions, those people who are in what we call the movable middle, answering all their questions, I think we can get there. And I think we're so close. Like we can see the light at the end of the tunnel. We just have to keep going and making ourselves available to answer their questions.
Mm-hmm. And if I could also add, Mr. Ellis, when people, it's a person's decision. I try to convince people, Dr. Lisa tries to convince people, but ultimately we have to respect the autonomy, the dignity, of the individual. And I think, when in the situations in clinic or otherwise where I've talked to people who've changed their mind, it's not like I'm, saying to them and scolding them as a lot of doctors do, you need to do this. No, first thing I say when I ask, are you interested in getting the vaccine? And they'll say, nope. I'll say, well, tell me why. Tell me why. Let me answer any of your questions. And so when you come from a space of mutual respect and lack of judgment, which is really pervasive, let's be honest, in our healthcare system and our society, so much. And we don't shame people, but rather try to understand their reasoning. Because I'm going to tell you, at the beginning, I was skeptical. I said, good thing that they are, looking at doing the mass vaccinations over in England, because I need more data. So I think that's one. And then I would also add that all the information that we're sharing today is the best information that we have today. So information gets updated, but I will tell you, I never, ever recommend something that I don't do for myself or recommend for my family. So for example, with the Johnson & Johnson vaccine, my brother, my niece, my nephew have gotten it. And I'm so sorry that they did the whole pause, because I think it was just, or making a mountain out of a molehill. I really, really do. And that impacted the trust issue and issues and brought up so many questions about safety. I'll just say this: taking Advil and ibuprofen and Aleve and all that and Tylenol is actually, you have more of a chance to end up in the hospital than the Johnson & Johnson, just to give you an idea. And then for young people, we are now seeing, and Dr. Lisa can speak to this better than I as an infectious disease specialist, we are now seeing these mutants, these variants, right, that are actually targeting young people. In Brazil, there are now more people that are young people dying of COVID than there are of older people.
I just want to piggyback on something Dr. Gigi was saying about the J&J vaccine. I fully agree with what she's saying. I also think we lost momentum when that happened. And sometimes during this pandemic, I ask myself, who's at the table that's thinking about our underserved and marginalized communities when they make this decision? For instance, the name Operation Warp Speed. Like, who was sitting at the table thinking about how that would play in the community with a name like that?
The racists that came up with it because they wanted to get credit. That's who came up with it.
Well, I wouldn't say they were all racist, Gigi. My point is we need better representation so that there's someone who's saying, well, wait a minute, if you make this decision, what will be the trickle-down effect, or what will be the impact, not just for the people you're thinking about with your blinders on, but all these people who always get left behind. And that's how I felt about the J&J vaccine pause, because I agree with Gigi. It was unwarranted. But here we are, and now we're trying to convince people it's a great vaccine. I still maintain, when people ask me, well, which one would you get? I would still say J&J, absolutely, because I'm all about convenience.
And I would say that I made this statement about racism because of the following. I'm sure that there were some clinicians, for example. I know that Dr. Fauci is very, very impacted by implementation science. However, if we think of the narcissistic, egotistical, racist, and put every isms that was in charge along with his administration, they were focused on, oh, I did this quickly, et cetera, et cetera. So I do think that, of course, ego played a role, but frankly, they didn't care. I mean, look how many people from our communities died. I think it was I call it a passive genocide. So there were lots of factors. But to your point, Dr. Lisa, I think that bringing the community into the conversation is always an afterthought. Community and representation is never there from the beginning. And we see this over and over and over again. So when people talk about diversity, it's not just the melanin in content in our skin. It is the people who are nurses, who are medical assistants, who are there like Dr. Lisa on the ground. It is all of the different professional, gender identity, age, et cetera, at the table. So I think, as I'm looking back and trying to kind of move forward and move the discussion forward, and more importantly, the impact forward, not just in COVID, because this is just the latest punctuation mark on health equity issues, but rather in our overall approach as we think about how to improve the health and well-being of Black and Brown people and all Americans, right? We have to look at the model, right? The model's not working. Now, there are places, like I just mentioned, Temple of Praise, that are looking at a more holistic model, but these are sort of, separate examples, and we have to do better at sort of the 30,000 foot level to be able to not just give voice. The community should be in the driver's seat. The paradigm has to shift.
Well, let me say one quick thing is that we did a Facebook Live a month or two ago, and the gentleman was on that talked about why they named it Warp Speed, and it was really the guy. He did have blinders on, Dr. Lisa, because he was a Star Trek fan, and Star Trek, they go to warp speed when they're trying to travel very, very fast, and so they were trying to equate this, and he had no idea how that was going to land, and nobody stopped him and said, hey, think about how that's going to land. He was a Trekkie, and they named it Operation Warp Speed. So that was that piece. The second, the question I want to ask you, Dr. Lisa, is with over 200 million doses having already been administered of the vaccine, why do you think some people still have questions about its safety?
Well, I think it's the combination of all the information, misinformation, disinformation. I think the big misstep was, and you couldn't have known this, right? So when we first started talking about vaccines, I think it was probably spring last year, the scientists were saying, we won't have a vaccine in a year. We'll be lucky if we have it like by next summer, right? Right. And then right behind that, they're being contradicted by Donald Trump, who's saying, we're going to have a vaccine by election day. His information was not predicated on anything scientific, right? Right. So people are hearing on one side, it's not possible. And then Donald Trump is saying it's going to be here by election day. And it almost was. So I think this notion that the vaccine was rushed is because of the way we messaged about it, and communicated about it in the early days. But had we allowed ourselves some wiggle room, I think everybody was surprised that the bureaucratic and administrative systems could actually be nimble and flexible, because they never have been. And so when all the bureaucracy was moved to the side to allow this to proceed at a warp speed, we actually have a medical advancement that we're not recognizing because of all the politicization. So I think that's the reason people are still asking. But when I address people to respond to this question, the first thing I say is, well, how long should it take to develop a vaccine?
Mhm.
And so just to make the point that we are relying on all this information coming in, but we're not actually doing our own due diligence to see, okay, maybe, this might be possible. Why isn't it? But then I also ask them, how many of you have ever taken any kind of medication over the counter or from your doctor? Why are we holding these vaccines to a much higher standard than the medicine your doctor writes or the medicine you buy in the Walgreens? So when people take a medication, they don't say, well, I'm not going to take this until I have 5 years of information to see if there's a side effect. And again, I just think it was a missed opportunity and a mistake, frankly, for us to communicate about the inability for us to develop a vaccine within a year.
So if I just want to apologize because I was so quick to say it was racist, not realizing the Trekkie's devotion.
No
so
worries.
I apologize, and it just shows you that that as open as I try to be, I sometimes am judgmental. So
no,
I want to own that. But I guess
what happened? What happened, Gigi?
No. I just said that I was Mr. Ellis was saying the warp speed name and all that. I'm like, because it's racist. But there is that element. I'm not going to walk that back. But if the individual who you mentioned, I'm not going to.
Yes. And it's really about the optics. And that's what I think is what Dr. Lisa is referring to, is it's the optics. And so when you have somebody, you've got scientists saying it's going to be a minute, and then you've got the president saying we're going to have it done by election day, and how self-serving that sounds. And then we get it, and it's just a little bit after election day. That people that already have distrust are going to have increased distrust. And then you hear it's called warp speed. Then all of the optics, you drop that all in a bag and shake it up. It's not going to come out smelling pretty good for the government. But let me get to, because I know there's some questions we got to get to. We got other guests and things like that. So I want to make sure that we address some of the main questions that we've gotten from our audience. And that has been a big issue with women in terms of fertility. And so we kind of want to address that, some rapid fire. Can pregnant women get vaccinated?
Yes, they can. Actually, there were women who were pregnant in the, I know for sure, the Moderna research trial. Even though they were initially excluded, there were women who'd been vaccinated in the trial and they got pregnant during the trial. And since then, the American College of Obstetrics and Gynecology recommend that pregnant women get vaccinated. We also have a lot of people asking questions about infertility. So does the vaccine cause infertility? Does it cause impotence, or, men can't get it up because of the vaccine? And there's been no association with that. Also, if people have gotten the Moderna and the Pfizer vaccines, the mechanism for those vaccines actually goes into your body, but then it disappears very quickly. It doesn't associate with your DNA in any way. It doesn't travel to the female or the male reproductive organ. So people shouldn't be worried about the vaccines causing infertility.
And the example that I've been using, to Dr. Lisa's point, of how the vaccine sort of works, for those that like Mission Impossible, either the series or the movies, remember when Jim gets the thing saying, this is your mission, and then the tape kind of disintegrates? So what happens is that the body is getting sort of trained about how to do make their own antibodies, and then the initial signal disappears. But I do want to give a shout out to Vice President Harris, because she established the community core, which is really to lift up and really upscale some of the work that is being done at the community level. And so, to be fair to this current administration, they're really playing catch up in a major way. That doesn't let our system off the hook in terms of the model, but we got to give credit where credit's due.
Amen. Amen. So we'll probably address, there was some other questions about mRNA technology and about if there's any differences between the vaccines that are being shipped to Black and brown communities versus the vaccines that are being shipped to mainstream communities. And we're going to talk about all that later in the program. I do want to shift gears real quick. So I'm going to ask y'all to hang around for me. We're going to have a Q&A section. We're going to talk about what's specifically going on in the DC area, and we've got some other guests to join. But I want to shift gears real quick here to introduce, and I just removed myself. So I'm going to try this again. I'm going to shift gears, and we're going to introduce our next guest, which is Dr. Derek Eglin Anderson, and he is a pharmacist, and he works with Walgreens. Welcome, Dr. Anderson. You're on mute. We both did it, brother.
Same thing. Thanks for having me. I appreciate it.
We both did it. We both did it. No question. No question. So did I pronounce that right? Is it Eglin?
Eglin. Mm-hmm. Eglin
Okay,
Anderson.
Perfect. So first question I want to ask you is, what is a vaccine, and what is a vaccine intended to do? Because the reason why that's the first question is because you're a pharmacist, you deal with a lot of medications, a lot of vaccinations, and you make those things. And I think people really don't understand what vaccines are intended to do. There's some misconceptions, and then everybody's like, go get vaccinated, go get vaccinated, go get vaccinated. But we don't know why. So could you tell us what vaccines are and what they're intended to do?
Great. So I guess the best anecdote I can think of is, people always say you can't teach an old dog new tricks.
Right.
Vaccines do that. You have a message that comes in through the vaccine that goes into your cells, and it tells your cells, hey, this is what you should be looking for. If you see this, this is what you do to get rid of it. You start an immune response to destroy it. So that's all vaccines do. They teach an old dog new tricks. They teach our system how a new foreign substance would look so it can actually reach it, get to it quicker, and destroy it much faster. So when people have the fevers and the shakes and chills, all those symptoms that they're actually having is their immune system acting appropriately to get rid of the virus or the bacterial infection or whatever that's in their body. That's their immune system saying, hey, I'm here, I see it, and I know how it works. So vaccines, there's two different types. There's the mRNA, and then there's the one that uses bits and pieces of older viruses. It pretty much makes them inactive. They're dead. They can't cause infection, but it's a piece of it. So if you had a slice of pizza, pepperoni pizza, everybody likes different toppings. So if you decide to have a cheese pizza, pepperoni pizza, beef pizza, vegetables, they all have tomato sauce most of the time. Mm-hmm. So if you make a vaccine that identifies tomato sauce, forget what the rest of it looks like. Forget the variants. If it can identify one particular piece that every pizza or the majority of pizzas have, your body will be able to identify it and attack it appropriately. And that's what vaccines do.
Okay. So they're to protect the body if it's infected, but it doesn't. So let me make this clear. It doesn't prevent infection.
No, they cannot prevent infection.
Okay.
So the flu, every other virus, there are tons of viruses out there. There's not just one flu virus.
Right.
So they can't prevent it from happening, but they can lessen the effects if you do come in contact with it and help your body remove it much quicker than it would be if it didn't have that same information.
Okay. So I want to make sure so are you vaccinated?
Yes, I am. Yep. It took a while because that surge in the beginning, it took a minute. So even like Dr. G said, I was kind of watching in the vaccine there to see what happened everywhere. And I have some of my friends that work in healthcare facilities. They were vaccinated in January and February. So I kind of watched them to see how things were going. And then I got my vaccination in March. So it's been okay.
So was it purely a business decision to get vaccinated, or was it something else that kind of helped you make that decision to go get vaccinated?
It was a personal decision. All of my family's in Texas and Louisiana. I'm in touch with hundreds of people on a daily basis. So I have that interaction with the community, and I don't want to be the reason the community has an infection. I don't want to bring that to them. I don't want to bring it to my home. I don't want to bring it to my family, and I don't want you to bring it to yours because of me. So actually, I did it for me. Walgreens didn't even tell me to do it. They didn't ask me to do it. They still haven't asked me to do it. I think that's a legal reason, but I did it for myself. So just like John Legend said in the video we just had, we miss doing the things we love and people that we miss seeing the people we love and doing the things we miss. We do. So it was an opportunity for me to have that extra protection so I can still serve the community the way I love to do and get back to some normalcy eventually when everyone else has an opportunity to get that vaccine.
Okay. So you mentioned Walgreens. What is Walgreens doing to engage in the community and to get more people access, particularly in the DC area?
Walgreens is doing a lot. Just about every store in Walgreens, you can go through the website, walgreens.com/vaccine schedule, and actually schedule your own vaccine for same day. You can get it in as little as 30 minutes in some cases if they have any slots available at that particular store. You can go through 1-800-Walgreens.
Wait. Did you just say you can do a walk-in?
Yeah,
oh wow, okay.
We do. We're actually doing walk-ins now for everybody. And since Pfizer is doing the 12 and up, we are also doing the 12 and up. So parents have to sign the parent consent form, but we can vaccinate those children as well. And we can do it same day. And then the latest thing that they've just launched was actually starting this weekend, this Saturday, is the mobile clinic. So we actually have a Walgreens mobile bus that's going to go to 20 different sites all over the nation and provide vaccines to people in underserved communities to make sure they have access.
Oh wow, that's incredible. So a mobile bus. So now that people don't have to go into the stores to get vaccinated, there's going to be a bus that's going to go around to underserved communities. Okay, that's wonderful. So in that, is that going to be, I guess, kind of counteract some of the distrust of some of these pharmaceutical companies or companies that are saying, okay, I've got to come in there versus, hey, look, I'm going to meet people where they are. Because we heard Dr. Gigi and we saw Dr. Lisa kind of talking about there's some distrust there. So going into the communities, utilizing other facilities, anything like that to grow awareness and really work with the community instead of having the community come to them.
Right. We have the Vaccine Equity Initiative. So basically, we're creating those platforms to give education to the communities. We're going into these events in these churches. And actually, I heard Dr. Gigi mention Temple of Praise, the mobile clinics at Temple of Praise this Sunday.
There it is. Wow.
So we're actually using those connections because we have to make it personal. We have to have a personal connection with who's giving the vaccine or who we're getting our information from. So what better than to go to where you're familiar with, to go to your officials or go to your place of worship, or even me being a pharmacist, they ask us to do these clinics offsite all the time. So even if you don't get it from my store, I can go to where you are if there's going to be a clinic there, and I can provide shots to those places, to those people, so they see a familiar face.
I know a lot of people, especially in Black and brown communities, a lot of people use, public transit. And so they may not have a ride to go to a store or even go to church, especially now with things being kind of shut down. Are there any ways, is Walgreens doing anything to overcome that? Because I've heard some initiatives. And so I just want to make sure, are y'all participating in those initiatives or not?
We are, and it's exciting. If you go into your Uber app, I don't know if you've done it, but in a lot of major cities, if you go into the Uber app, you'll see the Walgreens Band-Aid on the app. You can literally create your own transportation to your vaccination through your Uber app for free.
Oh wow. So you got that, so I want to make sure I got all this correct, right? So they can either go online. I think I put the link on the bottom of here, or they can call the number.
Right.
They will walk in.
Yep.
Families can now schedule together because they can go down to 15. I think I heard you say something about you can schedule both appointments too. Did you say that too?
Oh, I'm sorry. Yeah. So I probably spoke over it too fast, but basically when you schedule your first appointment, we want to ensure that everyone has their second dose if they're getting Moderna or Pfizer. So you actually schedule your first dose and your second dose at the same time. So you'll have those scheduled days. Plus we do call outs. We have automated systems. We do emails. So we'll constantly be in touch with you during that time, so you won't forget the day of your next vaccination. So the first and second dose will be already scheduled before you even come in for the first dose.
Okay, so you don't call outs. You got the mobile unit that's going to go around to underserved are you doing anything else? Are you partnering with any other community organizations, things like that? I see a question that people are now already asking, how can we contact Walgreens to utilize their mobile unit? So people are really excited about hearing about this mobile unit, because it is important to be able to meet people where they are, and sometimes they can't always get to. And I know Walgreens, I did my research project. I did like research. Y'all got 9,000 locations. I got a lot of locations, but still that might be difficult for people to get to, and you got to go to where they are.
Correct. So we have 9,000 stores that are participating in 53 jurisdictions and states, but we still have some areas we can't get to. So that's why they created the mobile bus, so we can actually go to those sites and actually get to those rural areas and get to those people that don't have that have the barriers that are keeping them from the vaccine. We're breaking that barrier down. It's already free, so let's bring it to you. And that's what we're doing. So as far as other community outreach, anyone that's open to coming up with a plan to actually get more people vaccinated, you can reach out to Walgreens through 1-800-WALGREENS, or you can go into your local store to ask for information. We have that information to where those sites are and what they're doing, and you can get that information easily. Or if you go through the website, you can schedule it there, and the website actually tells you where those site clinics are when you actually go to schedule your appointment through the app.
So, all right. So I'm gonna ask you the brother man question. All right.
Okay.
So,
you leaned in. I see it. You gotta lean in.
You gotta lean in when you about to ask me. Okay. So when someone that's black and brown come in and they see you, what are they asking you about the vaccine? What are you getting when people come into your site, they come into your location? What are they really asking you about the vaccine that they don't? What are they asking you in particular about the vaccine?
It's always two questions. The first question is, did I get it? And is there anything wrong? Did something happen? Is there a safety issue? That's usually the first two questions. And then we discuss, each person is different. Each person has a different fear or concern about it. And I tell them about my personal experience. I tell them about my mom. She's gotten it. I tell them about my father and my stepmom. My whole family is pretty much vaccinated. And I have those stories. No one's had any side effects. No one's had any major things. The only thing that we have experienced as a community is the lethargy or tiredness, and injection site pain, but you just literally stab the needle through muscle. So of course you're going to have soreness at the injection site. You just put a needle in your arm. So it's going to be an uncomfortable feeling, but it's soreness. It goes away in 1 to 2 days, but nothing major that you can't deal with.
Yeah, it was funny. Like, and I echo what Dr. Gigi was saying, and I had some serious apprehension. I'm not even going to lie. And it was my, and I work with Black doctor, and I was like, wow, and I was like, well, I'll just keep my mask and I'll just stay away from everybody, and maybe I'll just kind of fly underneath this radar. But then my wife was like, no, we need to go get vaccinated because of my in-laws, my parents. They have, kind of comorbid conditions. So we wanted to be able to see them and interact them safely. And so we made our appointments. I went in. I still had that anxiety going in. So I'm telling the story because I want people to recognize that it's okay, right? Those feelings, they happen in anybody. And I've been all these programs. I've seen these programs, produced them, hosted, all that stuff, but I still had some anxiety. But my desire to want to add to the community of people that are vaccinated to be able to engage completely and fully and wholly, because I see the CDC now says that people that are wholly vaccinated can go into restaurants without masks, right? So I want to be able to get back to what is normal life. And so I went ahead and overcame that fear, went in there. It was so quick. It was so quick. I was like, did you hit me? Like, did you do it? And then the soreness hit, and then I was like, oh yeah, they did it. They did it. But it was definitely, the experience in my mind was bigger than the actual experience when I went in there and did it. And even when I went back and got my second dose, it was the same thing. I was able to get through, and it was just like, it got through. So,
the shot itself, I will admit, is anticlimactic. I'm sorry. But
we need a bigger build-up. You got to play some music. You got to have the drums going or something.
You got to bounce and say, "You ready? You ready?" No, it's not. It's not soft. And my experience was pretty quick and easy. I actually went there before I went to work. So
Wow.
I went and got my shot, and then I went and did my full 9-hour day at my pharmacy. So and my mom's was the same. She walked in, she did the same thing. And, you know, I was a former teacher in Texas. So
Oh, wow.
being in Texas, seeing what, you know, Texas has done as far as not, you know, following the mask guidelines and, you know, everything that's going with Texas. I was fearful for my family and what was going to happen there. My sister-in-law, she was concerned that she had gotten it. And of course that sent chill waves through my family because we see these stories of, you know, devastating things happening to everyone.
Right.
So it gave everybody an opportunity to just, you know, think, breathe. This can happen. It can happen to you. It can happen to someone in your family. But we have an opportunity to at least add one layer of protection just in case. That gives us that extra barrier to kind of breathe easily. So it's
last question for you, and then I'm going to bring in our other guests here, and we're going to bring back Dr. Gigi, and we're going to have kind of like a roundtable panel discussion with everybody. So my last question for you is this: what would you say to those people that are still hesitant, that are still kind of on the fence about getting vaccinated?
I think the biggest thing I would say is your fears. I understand your fears, and I respect your decision. But let's get to the root of what's really wrong. What are your questions? Get to a person that can actually give you the answers that you need, that you can trust. Because education is powerful. As a former teacher, educating people allows them to make informed decisions. And so if you have all the information to make an informed decision for yourself, that's all I want you to have. You can choose not to get it. You can choose to get it, but at least you have the information. And that's why I was excited about this opportunity, because it gives you the option to get the information from trusted sources,
Right.
and you can make a decision for yourself. And if you want to, in DC, Saturday at Savoy Elementary on Southeast, and then on Sunday at Temple Praise Church. Those are the first two options in DC with the mobile bus. So,
well, all right. So I'm going to bring on our next guys. Thank you for that. I'm going to bring on Tony Young. And Tony Young, you're based out of West Virginia, aren't you, Tony?
I am based out of West Virginia, but I know Dr. Lisa since before I had gray hair.
We'll bring back Dr. Gigi too as part of this panel. And then if Dr. Lisa's still with us, I'd like to bring her back too. But Tony, what is West Virginia doing in terms of the vaccine rollout, the messaging around getting people vaccinated? And is that messaging different between majority community and Black and brown communities?
Well, thank you, first of all, for having me here, Ellis. I do appreciate these opportunities. You know, I mean, most people think West Virginia and they're like, well, and I was public health is not really our jam, you know, it's not our jam. But I got to tell you, I don't know how they figured it out. They did something right. Yeah. And, you know, and I hate to kind of contradict what Derek is saying, because I do think that kind of working with large retailers can work, particularly with large retail pharmacies can work. But in a place like West Virginia, where everything is county by county, everything is holler by holler, West Virginia decided to take a more direct approach and using smaller pharmacies. And so one of the things that, you know, yes, Walgreens and Walmart have large retail footprints, but, you know, I come on these with you and Dr. Tuxson, and I always talk about the fact that I believe that Dollar General would probably make an excellent vaccination site for many people in rural communities, in part because the data just bear it out. And the data bear it out because about the average age of a Dollar General customer is between 23 and about 45. And that's that band that we really need to hit in West Virginia, people who haven't been vaccinated. But we also have people like Ms. Norris, African-American woman, who is doing vaccinations at a church, Destiny Church in West Virginia, down in Martinsburg, West Virginia. So we have people that are trying to be innovative in how we approach vaccination in the United States, but particularly in rural America. West Virginia is only 4% African American, so I'm thinking Ms. Norris is probably going to get every one of them before she gets done. And I think the other kind of key thing that we're seeing is that, I heard what Lisa said earlier about kind of what the misstep was, but the reality of the misstep is that we didn't do vaccine preparedness. We didn't do vaccine preparedness in rural America. We didn't do it in Black America. We didn't do it in anybody's America. What we said and what we thought was that we would get a vaccine, whether warp speed or not, and that people would come running. You see the jerk in the movie The Jerk, when Steve Martin starts running down the middle of the street. The phone book is here. The phone book is here. The phone book is here. And I think that's exactly what they thought people were going to do with this when a vaccine was available. But the reality of it is that we didn't prepare anybody for a vaccine. And a couple of people have talked about it. The reality of our situation now is not to try and educate individuals and say, oh, particularly in red and southern states, oh, we want you to not pretend that this is happening anymore. And now we want you to come in and go get a vaccine. We want you to forget your politics and come to the door and be a participant in sound public health across the United States. Not so much. What we need to do is really, and I think Derek kind of really hit on it, is that what we really need to do is to begin to get them to understand this through, those of us who worked in the HIV space, social networking theory. That's what we need to apply here. This is not about you. This is about mama and them, because you're poor, you're living in a multi-generational household. This is about mama and them because you're probably an hourly wage worker and you really want to go back to work and you really want to be able to support your family. It's about mama and them. You don't want to get mama sick. And now that we've got the opportunity to actually vaccinate individuals, for that 15-year-old to 20, whole different kind of category of individual. That's a whole different can of worms. Those people are like, yeah, I need a vaccine. I didn't get the COVID the last time. I'm not getting the COVID now. Keep it. Use it to somebody else. And we've got to get them to understand how it is that they play a very key role. Because, we talk about herd immunity. And one of the pieces we keep missing in the herd immunity is, maybe 70, 80% we can achieve herd immunity. But the last piece of that statement is not in the United States, in the world.
Right.
We got to get 70% of the people in the world. And now, listen, cruise ships opening back up. Planes are opening and full again. Right. I mean, so what do you think people are going to do? Again, the vaccine's here. Now they're all going to run on vacation is what is about to happen. And if we don't do something very soon, very quickly, and I appreciate again what Derek's talking about, because it's what I believe, particularly in a place like West Virginia, is that we need mobility and portability of services. Mobility and portability of service. No matter how you slice this, whether it's a vaccine for COVID today, a flu vaccine, an HIV test, or a Hep C test. Rural America is in the middle of a syndemic. They're in the middle of a syndemic around HIV, viral hepatitis, and substance use disorder. Most people don't know West Virginia's got an HIV outbreak right now in the middle of a pandemic. So what do you think is going to happen when people are freer? People are going to have more sex and they're going to use more drugs. So what this is going to probably mean, I mean, people I know that know people, not me or the people I know or the people here. We're going to go on to work and doing our public health. We're not going to have the sex and use the drugs. But we need a plan. We need a plan, and we need a plan quickly.
So, Dr. Gigi, you hear that, and Tony brings up a good point that the vaccine got dropped, and they expected everybody to come run and say, "Come give me a shot," and it didn't happen. And so now, how can we craft that messaging to get people to come in and get vaccinated and go to or wait for the bus to come by or go to the church that Derek is talking about or whatever we need to do? How do we get people? What's the messaging?
So the messaging, first of all, can I say what an honor it is to be with such a lovely panel and how inspiring it is? Because, the work that we all collectively do can be, kind of tough, but to see other people, like-minded professionals, is just heartwarming. And so I just want to just kind of put it out there, because I don't think that we kind of sit in that space. We're just going, going, going. And so thank you for allowing me to be with you. So one of the things, the model that we used, which I think is an important one, and I don't know how innovative it is, but we'll put it out there. When we had the 10 community-based organizations that were actually signing people up, registering people, because they know best who's in the community, who is a shut-in, who doesn't know how to navigate computers, which, by the way, is everybody, because the system kept crashing, right? All of these sort of barriers, they registered folks, right? Number one. So what we did is we actually held 7 90-minute sessions as a train the trainers model. And that does two things. One, it gives the people who are actually coming into contact, who are the trusted human beings that work in the community, number one. But guess what? It also increases the intellectual capital of these communities, which is another really important thing if we're going to make a dent in health disparities. So we did that, made sure that we answered questions, had an open town hall. And actually, there were a lot of people in the community-based organizations that said, I don't think so. And so one of the most powerful testimonials came from somebody who said, you know what, I've never gotten a vaccine. And I am there. So how powerful is that when he's going to reach other people? The second thing is that, of course, on the day of the event, Dr. Lisa, Dr. Clark, other people, we had our pharmacy, School of Pharmacy from Howard, we had Howard, GW, Georgetown, all working together to answer questions. We said, even if you don't want to get the vaccine and you're still on the fence, just come on down. Let's have a conversation. And then I think the important thing is that actually, we had our event April 3rd. I believe the pause with Johnson & Johnson was April 9th. And that's the aftercare. It's not like we deserted and no, we went back and said, hey, what are you hearing? Do we need to have a town hall? And the leadership said, you know what? Not so much, because we are able to answer the questions. So we provided them a, sort of 10-point flyer so that they could kind of use that as a script. So that is really what we want to do. And just like what Mr. Derek was saying, we also had free childcare on site. We had Uber, and we did have some music, because Mrs. Cora Masters Berry had a go-go DJ, and it was festive, and it was finally at the level that the good people of Ward 8 deserve. It was not an A-, not a B+. It was an A++ event, and that's also the point. So, Mr. Derek, we're ready to do the mobile clinics. We really want to do that. Moving forward, actually, Dr. Lisa knows that the Rodham Institute, before all of this began, we wanted to do mobile clinics because we have the capacity so that we can reach people. And for people who say, well, how come, the people in Ward 7, 8, or people in rural America need this? It's because we don't have any of those things in those wards. We don't have enough pharmacies. We don't have enough grocery stores. We don't have sidewalks necessarily for people to walk, or a safe space for people to walk. We don't have all of these things, clinics, where you can just sneeze and see a clinic, or buses. So yeah, we have to recreate a community that was decimated and dismantled.
I want to bring on our next guest, and this is John Johnson, and we're bringing him on. He lives in the DC area, and we wanted to ask him about his vaccine story. And John, the floor is yours, sir.
Hello, everyone. First of all, Dr. Gigi, is that your name?
Yes.
What you saying is absolutely wonderful. I think, when you think about people of color and trust and institutional racism, all of that is connected. We don't have urgent care east of the river. So now all of a sudden it's like, oh, this vaccine's important. And those folks who have long-term memories are like, hey, but you didn't care about us before. And now all of a sudden, it's like now this vaccine is being pushed on us. And all of the stories about our grandparents, or that Black people's skin is thicker you know, so therefore we have a high pain tolerance. Those things are in the dialogue of the community members. And so I personally understand why people don't take the vaccine, and I also understand why people do, you know, so I'm going to share my personal story around it. I just wanted just to kind of clear that up, you know, like I understand completely why Black folks are like, nope, I live in America. I don't trust any institution that has supposedly tried to serve me, whether it's the police or whether it's a medical institution. So I think, you know, having Black physicians and people who look like you, have conversations with you and be patient with your decision. You know, whether you choose to get it a month from now or, you know, you got it yesterday, you have to be patient because you have to understand that folks are making decisions based upon logic and legitimate reasons. So I think I want to clear that. So for me, I'm 40 years old and, you know, I'm a storyteller. So I talk to a lot of people all day long. And what convinced me, I had the same, you know, apprehension. You know, at the time we had a president who I didn't trust. So why would I trust anything else that comes from that administration? And I was like, hey, you know, just like Black folks have done over the years, we had to defend for ourselves. So I would just, you know, drink ginger and wear a mask and just hope I don't get it. But my friends who actually did have COVID, many of them, you know, initially it was like a stigma to even getting it. So many folks didn't want to share like, oh, I got COVID, or, you know, you saw someone disappear for a while and then they went in the hospital and then you asked them what was wrong. And they're like, oh, I had COVID. And many of them survived, you know, they didn't die in my age range. You know, most of the men I talked to were probably between 47 and 35. But some of them had some lingering issues. They had blood clots. Someone was still on dialysis, you know. So I think the conversation about the lingering effects of COVID is really important in convincing some folks to get vaccinated. I think that's just a good discussion to have because that's one that's not necessarily as present in our community. But they all said, John, I thought I was going to die. And I was like, whoa, like every single one of the men who I talked to said, I felt like I was going to die. They were very, you know, they felt very fortunate that they didn't. But I'm like, who wants to go through that process? If I'm going to have a sore arm and some side effects, I'll take that risk. If indeed I don't have to say I felt like I was going to die because I've contracted COVID, you know. So I will tell a quick story about like my first shot because I think it's also indicative of how Black people in America have this interesting relationship with the institutions that supposedly serve us in America. So I went to the convention center to get my shot, and you know it's kind of like herd vaccinations. Like, you know, many people come at the same time. You know, folks are getting vaccinated like 40 folks at a time. Then you move over to the next room and you're in observation for 15 to 20 minutes. Then you go home. So, you know, the whole time you're looking at the people in the chair, like, okay, no one's passing out. Okay, all right, you know. And so I sat in a chair and I actually had a Black woman give me my shot. And initially I cracked the joke. I was like, you know, it's not a lot of Black people in here. And, you know, I'm only here for the colorful stickers. You know, she chuckled a little bit and the colorful Band-Aids. And so she chuckled a little bit. And I was like, you know, but there's a lot of apprehension about this vaccine. And she's like, yeah, I know. And I was like, well, can I ask you a personal question? I was like, are you vaccinated? And she said, no. And I was like, you about to put this shot in my arm and you've chosen not to get the shot yourself. And I was like, well, can you tell me why? And she went on to explain that her father died 3 years ago of liver cancer. And she said she was upset because he went in for some other minor procedure and they never caught the fact that he had this cancer that she felt they could have cured if indeed they were treating him like a whole human being, basically, not like a Black man, you know. And she said the reason she's in the medical field is because she wants to prevent that from happening to people who look like us. Right. So that was her. And then she said in the same sentence, but I am so upset at the medical field, I don't want to get the vaccine. And I feel like that story is the story of Black people. It's this kind of schizophrenic relationship that we have with the institutions in our community, where so she is literally vulnerable every day, giving people shots to protect them, and she doesn't have one herself. Like, that is the story of being Black in America, or being of service to folks in America. And I understand where she's coming from. Like, you know.
Go ahead,
Sorry,
Tony.
John. I apologize. I thought you were done. I apologize.
No, you're welcome to chime in. I mean, I'm just telling you, I got it because all of my friends, and that's what I'm saying. My last little point is like, you also the culture. She talked about like, oh, in Southeast having go-go music and all of these things that connect to your culture. Like, we don't trust Fox 5 or CNBC. You know what I mean? Like,
right.
Every now and then we be like, okay, Tony Fauci seems okay. You know what I mean? But we trust the people who we know, our neighbors who talk to us. We have a nurse across the street who works at UMES, and she was giving out masks. You know what I mean? I don't know if she got them from UMES or not, but she was giving out masks when the COVID hit. Like, she was caring for our community. So if she says, hey, you know, I'm a vegetarian, and we were like, well, let's stop eating meat. Or if she says, I got the vaccine, like those things. So she is more important than the vice president getting a vaccine and being on TV. She's more important than anybody else because that's someone we trust. She's been caring for us before the pandemic. You know what I mean? She's been giving us information before the pandemic. We have a trust with her. But everything else is like, you know, and that's what I'm saying. I think it's unreasonable to think that people don't come from a place of logic when they explain why they want to get it or why they don't. And I think that's an issue because that means you don't understand systemic racism in this country when you discount someone's fear, especially if they're Black in America.
Tony, what were you going to say?
Well, I was going to say that there's a scale, and it's called the Seller scale. And we used it when we were looking at whether or not African-American people, Black people, would participate either in a clinical trial or in an HIV vaccine trial. So we did a study with over 3,000 people in DC, Florida, and in Oakland, California. And the Seller scale really measures whether a person will have hesitancy around a vaccine, depending on what their militancy or whether they're an assimilationist, right? And so the natural instinct is to believe that the assimilationist is going to be more inclined to take a vaccine or participate in a vaccine trial. In this case, an HIV vaccine trial, not COVID. But I think that one of the things that John is talking about, and I hate to say it, John, you sound a little militant to me. Sound a little rough. Like.
If militancy means love, then yes.
But I think it can. I think it's priority. Let me.
Okay. I do want to address militancy versus assimilationist. Those are really interesting words too.
I'm only telling you what the domains of the study are, not Tony's opinion, but the domains of the study, right? So they looked at militancy, and then they looked at whether or not someone was an assimilationist. And what we found actually in the study is that more people that were defined as assimilationists were less likely to participate because they did a whole different intellectual process. Whereas people who were defined as probably a little more militant were more likely to participate in the studies. And the reason that they were more likely to participate in the study is because they had different experiences with large structures and systems. The person who was not necessarily an assimilationist, but seen as a little more, let's go with radical, okay? Was seen as a little more radical, was more than willing to participate in the clinical trials and other studies because he or she said, wait a minute, and again, processed the information very differently. What they saw was an opportunity to actually care for community in a way that the assimilationists did not have the same goal. They did not have the same natural inclination. They didn't think, well, I am going to protect community. There was not a sense of altruism for them as there was with the more radical, more militant thinking, that they were more likely to say, I need to take care of community. But the others had more of an understanding of large systems, whether it was a phone company, a university institution, but that they could relate to a negative outcome through those institutions. So what we were able to find out is that, again, I mean, I think we're all kind of proving the data out, but it's really about your social, sexual, drug using, music, food network, drinking buddy. It's all about that network. and so the individual who is more militant, radical, is more likely to be engaged in those networks.
Mhm. Mhm.
Yeah. So what is the? Everything you say. I think first of all, thank you for that information. What is someone who's an assimilationist and someone who is militant? Like,
So
I don't know what those.
assimilationist was typically defined in this case with someone who did not have radical ideas. They went along with the system as the system was. Whereas other individuals, and I can send you the details of the entire scale and who is what and how each one is defined. And you might find yourself more in the assimilationist group. I don't know.
Yeah, I mean, it's just those are interesting terms: assimilations versus radical.
I know. Don't let that be the trigger. Don't calm down. Move off of those. I can see that triggered something. Get off of the trigger. Whatever I did to trigger you, I'm sorry. I'm gonna come over. I'm gonna give you a hug. I didn't mean it that way.
I'm a militant person that takes hugs, so maybe that's my assimilation.
And there we have it.
So I'm just saying those are just interesting terms, and I'm saying that they need to be defined for me to really.
Can I say this? Can I add this piece to it? I think ultimately it is about the term. So I feel you on that, John. And so in terms of when we say militant amongst our circles, we're saying somebody that not only loves the community, but is willing to defend the community. Mm-hmm. And so that is how militant is. When I hear the term militant, if I'm talking to other folks that look like me, militant means, okay, that person loves our community and he's going to defend our community in any type of way. Mm-hmm. In terms of an assimilationist, they may be a little bit more passive with regards, not saying that they're discounting any type of their love for the community, but because they understand the systems a little bit more, they may be a little bit more passive in their defense.
Mm-hmm. Their altruism, right? It's the true measurement. Less altruism. So, John, like I said, I'm making, I do.
Yeah, but I think ultimately in that love and defensive community, there might be somebody that's a little bit more willing to participate in those clinical trials, participate in those events, and say, hey, look, because these things that this trial is intended to study are hurting our community at a higher level. HIV, drug use, COVID, diabetes, whatever we're talking about, those things are impacting our community at a higher level. So if I'm a healthy individual, and if I know that if I am in this trial, they've got a better chance of getting medications or drugs, whatever, that can help my people in my community, I'm willing to stand on that line and do that and participate. And so I think that's really, I think it's noble. I'm with you though, John, in terms of the terminology, because of how the mainstream society hears those terms very differently. Right? They hear militant very, very differently. They hear, people are going to be throwing chairs and windows and throwing rocks and stuff like that. That's not what militant means in our community and in our circle. So
can I suggest something? So just to bring both of the perspectives together, perhaps, and I know that this is a study and not your choice of words or terms, Ms. Tony, is that altruism or community engagement is really what we're talking about, because, and then we can just kind of, because of all the reasons that were just articulated, those other words can have a judgment associated with it. But for somebody who is a radical and is militant, I embrace it, Mr.
and ultimately, I feel like what you're talking about is trust. So someone who's militant, someone who does not trust a lot of the institutions, or someone who you say is passive, is someone who has more trust.
Not necessarily.
I know, but I'm just saying. But that's what I hear. I'm just telling you.
Yes,
what I
got it.
And that's not what I'm suggesting at all.
And at the end of the day, when you want to have community engagement, whatever words you use have to be the words that the people use. So if you go into a community saying, I want the militant and the passive people to get the COVID shot. But
you know what?
I mean, and I know we have to end soon, but
we do.
I think we're beating a dead horse, because I'm using the language that was in Sellers' scale. But I think that what we do is that, so I don't want you to think that, again, that this is language that I've used or that I do choose to use, but what it is it's what a measurement tool is, and that's it. So if you could now keep all the radical people off my back and say, hey, I understood what she meant. Because right now, all the radical people going to send me a text message saying, I'm not militant. I'm just looking for you. And so, I mean, I'm born in Southeast. I understand what time it is. Daddy's still on 29th Street. I understand what time it is. I'm just trying to report the study out, man. Leave me alone.
But if I could say this, because, people know somebody who's sincere and credibility, and yes, words matter, but actions are so much more important. And so I'm going to share with you a word in Arabic. It's called wafat. Wafat is kind of a combination word that brings together decency, loyalty, and a longer term relationship. And so if people feel that, okay, because it is more about our feeling, right? And words matter, that's true. But, we feel each other. Look at our language. I feel you, all of that. That's what is matter. Actions speak louder than words. So we'll move on from that.
Absolutely. So I love this. I love this dialogue and this course, but that's a work for a later period. So what I'm going to say is we'll give everybody the opportunity to kind of give their last word on this topic tonight. We're talking about DC. We're really kind of talking about doing a deep dive. Is the messaging landing, right? So John, I hear you. Exactly what you're saying is that, and what Tony is saying, and even what Dr. Gigi and what Dr. Lisa was saying, is that what we've got to do is we've got to speak the language of the people, and we've got to meet the people where they are, and we've got to utilize trusted messengers. Can't go in for people that aren't part of that community that they don't trust. That's a big word that we've been said many times tonight. You can't send somebody into the community that the community doesn't trust. That community is going to spit them right back out and not do one thing that person is trying to tell them. Even though it could be the truth, it could be actual, it could be factual, it could be great and everything. So you got to connect with the people who they are and get those trusted resources and give them the information, and then they'll share it with the community. And I think that seems to be the theme that we've come out in terms of DNV and even going forward. Next up, in terms of what Derek is talking about, is having those corporate entities that are willing to go in, that are willing to say, we're going to meet you where we are. Okay, you can't come into the store. Let's get a van and let's get a mobile unit and go out to the communities. Let's go to the churches. Let's go to the schools. Let's meet people where they are. We're going to put our resources behind that and go into the community. And then the community can come to us and we can stand there and say, hey, look, here's why we're here, because we want you to feel safe. So I think we're all on the same page when it comes to talking about how we're going to defeat this COVID vaccine. So I'm going to start with you, John. Give your last word, 30 seconds. What you want people to know. And
So this is John Johnson, the militant / Black people need to be in every facet of life. So in our community, the physician, Anacostia High School needs to have some relationship with Howard University, GW, so we can produce more doctors and medical professionals, so that then the words come from the community and not someone who's imported into the community. So shout out to Dr. Lisa for living in the community, because that's somebody who we trust and somebody who we're willing to talk to, because we know you live and breathe the same air of the community and you deal with the same ills of them. And then also community trust that we can answer the questions within. But I do think that with the COVID has shined light on the inequalities and some of the fields that we need to actually get into. So in addition to encouraging people to get the vaccine, I think there need to be more protracted programs to get people involved in the healthcare world, in vaccines, and all of the technical things that we're going to need ultimately if we're going to live on this planet and survive in America as well as around the world. So those are my 2 cents. Thank you.
All right. Tony?
You're muted.
Muted. You're muted.
You're muted, Tony.
I muted myself because I was going to yell at John and I stopped. So I think John's a great guy. And I don't think he's a militant. I think he's warm and fuzzy and kind of, like Oscar from from Sesame Street. That's how warm and fuzzy he is. So here's what I think. I think that many places, particularly in rural America, are in the middle of an existing syndemic of HIV, viral hepatitis, and substance use disorder. I think that COVID came along and certainly, as John articulated, highlighted some things. But I think that we also have to remember that we're in the middle of a conservative wave across the United States. So many of the states that we need to make sure that we are vaccinating Black and brown folks and poor folks in are going to be run by Republican entities, which may not necessarily support vaccination or putting money into vaccination, although they want to open back up. All you need to do is kind of look at a map of who opened up first and right away. And I think that's an indicator to us. I think that we also have to figure out not just how do we work with our big partners like Walgreens, thank you, Walgreens, for everything that you're doing, but also how do we get small mom and pop nonprofits and other groups the resources they need for recruitment and retention of individuals who are coming into their organizations, particularly those that do medically assisted treatment, those that are recovery houses, those that are doing food and nutrition programs across the United States. I think we have to do a better job of engaging those frontline providers who may not have had a public health background, but they are certainly touching the individuals that we want to educate and we want to vaccinate. And we also need to still do vaccine preparedness across the United States. That's my nickel's worth of whatever.
Derek.
Hello. I just want to start off by thanking everyone. This has been a great opportunity and a great conversation between us. I think the biggest thing for me is education. If we have the education to make an informed decision for ourselves, we can decide to either get the vaccination or not. As far as resources, Ms. Tony, when you talked about those resources being in rural areas, I'm actually from a small area in Louisiana. There was one red light in the whole city, and it came when I was 10 years old, right in front of Brookshire's. So I've seen what that looks like, and I understand what you mean when there's smaller opportunities that need to be exposed or exploited to get to those rural areas to help those people. And that's why Walgreens has created the mobile unit to try to help combat that barrier there. We've vaccinated 15 million people thus far, and we have a 95% rate to ensure that those people get the first dose and second dose. So it's important that when you're taking Moderna and Pfizer that you get both the first and second dose. Johnson & Johnson is one dose. The pause definitely slowed the rate, but we will have the Johnson & Johnson and Pfizer available on the buses, the mobile unit. And in DC, that's where the mobile unit is starting with the first 20 sites. The first one is Savoy Elementary on May 15th. And the second site is at Temple Praise Church on May 16th. On the Saturday, it will be from 11 to 5, and Sunday, it will be from 2 to 6. So I hope that those that have made an informed decision and have decided to get the vaccine have an opportunity to get there. And don't forget, Uber can get you there with Walgreens help.
Mm.
And Dr. Gigi.
Well, I think that the perspectives that were shared this evening are just so key. And you see that all of our perspectives are needed if we're going to move the needle, not just on the COVID pandemic, but on the health and well-being of Black people, brown people, and all people. I think that I really appreciate Mr. Derek's comments and his perspective as a former school teacher, because I don't think that we look enough at what we learn, what we should learn rather, from our education colleagues, from our behavioral health colleagues, because we need to understand how people make healthcare decisions. So we need sort of the science there, but we also need simultaneously the people who can connect and those trusted voices. And isn't it great when you have all of those elements together in one human being, as each of the people that have illustrated on this lovely conversation? I would say, whether you call us radical or militant or whatever the term is, we all lead by love. Love of our communities. And I think that to Mr. Johnson's point, that is what we lead with. And I would say that, sort of with this pandemic, with this current system of what I believe is medical apartheid, we have to look at attacking all of the issues simultaneously. So I'll share with you what my father, Egyptian father, says. when you are dealing with a complex problem, okay, like if you're eating a hamburger or a vegan burger, you don't put the bread first and then the lettuce and then the tomato and squirt ketchup and mustard. No, you eat the whole thing at one time. So that's just to say that all of these issues, housing and food, the idea of hopelessness, the idea of competing priorities, access, these are all interrelated. The legal aspect, the policy, the politics, they're all related. And one thing we didn't talk about, which I just want to kind of acknowledge, is the mental health piece. We just had our summit, the Rodham Institute's annual summit, and you can go to our website. And the mental health piece is really what is impacting so many people across the country. And by the way, food is the number one social determinant of mental health, right? So if people are not eating, how's that going to impact their health behaviors? So it's all interrelated. And Mr. Johnson, please visit our website, because workforce development is something that we have for middle and high school kids, and lots of programs, because again, the parallel approaches have to happen together. And I just want to say thank you to you, Mr. Derek, from Walgreens, Mr. Ellis, as you so eloquently, and by the way, Mr. Ellis has a mental health background, and that's why he's so good at being a moderator, Ms. Tony and Mr. Johnson. So just thank you very much for the honor and the privilege of being with you tonight.
Well, I want to thank you for that, Dr. Gigi. I want to thank all of our guests, Dr. Eagle Anderson, Tony, John Johnson, and Dr. Lisa. I want to thank everybody, Walgreens particularly, for joining with us on this topic and in this discussion tonight. And I think our discussion, especially even at the end, our discussion talks about what this whole pandemic has been about. It's been about information, and the information and how it's presented. And if we present information in a way that is not culturally relevant or doesn't speak to our culture, then it's going to be misinformation or disinformation. And so what we've got to do is we've got to recognize the right words, the right way, and the way to present it. So the words that I heard tonight: love, trust, respect, honor. That's what we need to do. And so with entities like Walgreens, hearing those words, recognizing and saying, coming in to the community and saying, you know what, we're going to respect the community, we're going to honor the community, we're going to try to find a way to reach the community. We appreciate that. When we're talking about this particular pandemic and getting people vaccinated, we can't come with wagging the finger of, oh, you got to do this because I told you to do it. We got to do it. Like John was telling us tonight, hey, he got the vaccine because he said his friends felt like they were going to die that got COVID. And he said, I don't want that feeling in my life. But he got it from a trusted source. And that helped him make his decision. So the last thing I will say to you tonight is, if you've been vaccinated, or if you're planning to go get vaccinated, take a friend, take a family member, talk to them, get them to know it. You got to connect with them. We've got all the intellectual information. If you go to blackdoctor.org, we've got a COVID-19 channel right there. We've got a resource center ready for you to go to. You get all the information about COVID you want to. But I guarantee, and the vaccines, but I guarantee you that the best information is going to be you talking to a friend that's been vaccinated. Ask them how it was and ask them how they feel. So again, that's going to be the end of our broadcast tonight. Share this with your friend, tag a friend, let us know how everything went, and we will see you soon.